once again to the Solve Wounds channel. Today we'll be talking about wound care after surgery. Now this is a very broad topic because there are varied kinds of surgeries at various sites of the body. But I will just talk briefly as to what to do when you have had a surgery and the wound care after surgery. Now, depending on the preference of your surgeon or the environment in which you are or the site in which the surgery is done, usually a dressing is put on the wound. The dressing can be from povidone iodine to any of the silver dressings or any kind of dressings put on the wound. Now, based on the kind of dressings on the wound, usually there will need to be a review of that wound, usually within 24 hours, some within 48 hours. In some instances, depending on the kind of dressing agent that is used, it may be longer than that. So the dressing agents may determine whether there needs to be a change of dressings. Now, during this period in which there's a dressing on the wound, it's important that you as a person prevent that place from getting contaminated, keeping the place as dry as possible, not allowing dirt and other things from the environment to get into the wound. And if the wound is, the wound usually will be covered, ensuring that the wound remains covered. Sometimes after 48 hours, some people leave the wound open. And when this happens, they expect you to be more active in terms of your wound care. That may mean that you may need to have a topical antimicrobial in which you rub on the wound, and you may also need to be cleaning the wound regularly, either with an alcohol or just with normal saline, just to keep the place dry. So these are the things that you need to do and comply with the post-op orders of your surgeon. That is what you need to do when it comes to wound care of the wounds. Then something else you also need to note. If you note that the wound, rather than staying dry, begins to have some form of discharge, and the discharge usually may be watery, then the discharge now becomes smelly, it means that there's a wound infection, and you need to pay proper attention to the wound so that that infection is properly treated so that the wounds will heal as fast as possible. Welcome once again to the Solve Wounds channel.